Dr. Suvarchala, Scientific Director with ZIVA Fertility Centers. Today we are going to talk about how to evaluate infertility. Let's divide them into steps and see how infertility is evaluated. Step 1 is to determine if the woman is ovulating. A regular menstrual cycle, which is around 21 to 35 days, with premenstrual symptoms, which could be breast tenderness, fluid retention, indicates ovulation. So that's the first step. Irregular cycles means that the cycle duration is less than 21 days or greater than 35 days, or amenorrhea, very little bleeding, or abnormal uterine bleeding are suggestive of an ovulation. If ovulation is not clear from talking to the woman or taking her history, we check the serum progesterone on day 21 of the menstrual cycle, and a level greater than 3 nanograms per ml means ovulation has likely occurred. So we can evaluate if she's ovulating or not. Step 2 is to look at a few tests based on ovulation status and if there is evidence of ovulation or not. Then check thyroid stimulating hormone, prolactin, FSH, LH. All these levels also give us an indication. In women with signs of PCOS, that is if they have acne, hirsutism, male pattern hair loss, this also indicates that we need to check additional hormones such as free and total testosterone, DHE hormone as well. So the evidence of ovulation comes from evaluating ovarian reserve with one or more of these following tests that I'm going to talk about. AMH hormone levels, if it is less than 1.66 nanograms per ml, it suggests that it is a low ovarian reserve and maybe we should begin treatment. FSH and estradiol levels on day 3 also indicate us whether ovarian reserve is less. If FSH is greater than 10 to 15 milli-international units per ml and estradiol is greater than 60 to 80 picograms per ml, it suggests that the ovarian reserve has come down and you should begin at least treatment for fertility. A pelvic ultrasound with antral follicular count. Antral follicles are basically resting follicles which are 2 to 10 millimeters in diameter and they can be seen on ultrasound. So a count of less than 4 follicles in both the ovaries combined suggests that the ovarian reserve is low. So these are very important tests. Alongside of this, we also test the male partner's semen. We look at the semen parameters and then we evaluate whether the cause for infertility is with the woman or the male or both of them, and then the treatment options are given. So further evaluations are also there, like pelvic ultrasound. We do this to evaluate uterine abnormalities, hysterosalpingogram to evaluate tubal patency, etc. So these are also very important. When all these are done, step 3 is to consider treatment options based on results. So an abnormal TSH, thyroid stimulating hormone, whether it is hypo or hyper, should be treated, and after treatment we see if ovulation returns. An elevated prolactin, called as prolactinema, should be treated, whether a surgery or dopamine agonist should be given and then tested if ovulation is returning. In PCOS obese women, weight loss of more than 15% can cause ovulation to return. So it's a very good sign. If weight loss is brought about, then weight loss can also result in proper ovulation and regular cycles. Metformin may also be beneficial for women with type 2 diabetes or glucose intolerance. Clomiphene and letrozole are treatment options for women with PCOS. When it is low ovarian reserve, referral to a fertility specialist for ovarian stimulation or IVF, etc. is done. When it is hypogonadotropic hypogonadism, which is low FSH and LH, then again fertility specialist will give them pulsatile gonadotropin releasing hormone, which can release or increase FSH and LH. These treatment options are given. When the semen values are low, then a urologist will evaluate this and then decide what treatment options to offer. If there are uterine or tubal anomalies, the abnormalities, then further evaluation has to be done. What kind of uterine or tubal abnormalities are there, and based on that treatment options are done. So these are the steps basically to evaluate and treat infertility. If you wish to understand more, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.